Alright, this is Pack 365. Myself, Srija. So today you are going to learn about the ICD and CM coding guidelines for diseases of the circulatory system. So in this session, we are going to learn about few ICD guidelines like how to code the diseases when they are diagnosed. So coming to codes from category I69 with codes from I60 to I67. So this slide is about the ICD and CM coding guidelines for cerebrovascular diseases like stroke and also the heart attack. So these codes are used together whenever a patient has an old stroke that left lasting effects, and also the patient currently has another cerebrovascular problem like a new stroke or other brain blood vessel diseases. For example, if a patient had a stroke years ago and still he has a weakness on one side and now he has a new brain bleed, so you have to use both codes, okay? This is about the codes from category I69. So codes from category I69 and also the personal history of transient ischemic attack and cerebral infarction. So how do you code these? If a patient doesn't have any long-lasting neurological problems from a past stroke or TIA, you have to not use the I69 code. Instead, you have to use the personal history codes, that is Z86.73. So which just means they had one before, but they are not fully recovered. They have it, but they are not fully recovered. So it denotes a history code. So we have to assign the code Z86.73. So next, coming to the acute myocardial infarction. So what do you mean by acute myocardial infarction? It is a heart attack, okay? Type 1 STEMI and type 2 STEMI and NSTEMI. So what is STEMI? It's a major heart attack with full artery blockage. Whereas NSTEMI, it is non-ST elevation MI, a smaller or partial blockage heart attack. So if ICD-10 codes for type 1 MI identify where the heart attack happened, like whether it may be happened in the front wall, whether it is happened in the back wall, etc. So you have to use the codes I21.02, I21.2 and I21.3 are used for the type 1 STEMI. ST elevation myocardial infarction. So if a patient has a STEMI affecting the front part of the heart, you have to assign the code I21.0. So now understanding about I21.4, the NSTEMI. So what it means? So code I21.4 is used when a patient has a type 1 NSTEMI, which is a type of heart attack that doesn't show the classic ST elevation on an ECG. It doesn't show on ECG. It's also used for the non-transmural MIs, meaning the heart muscle damage doesn't go all the way through the heart wall. So what to do if this condition changes? If a NSTEMI later becomes a STEMI, you have to assign the code STEMI code from I21.0 to I21.3 category instead. If a STEMI later changes to NSTEMI, for example, because of the treatment, you have to still code as a STEMI. So the point which you have to remember is that always code for the most severe or initial presentation. So STEMI takes the priority over NSTEMI all the time. So never forget this point. So what are the timing rules for myocardial infarction coding? So if the myocardial infarction is less than or equals to 4 weeks old, that is acute phase, you have to use category I21 codes, that is acute MI. So this applies even if the patient transfers to another hospital or care setting during the time. So if the MI is greater than 4 weeks old, but the patient is still receiving the care, like maybe a cardiac rehab or maybe a follow-up for the complications, you have to not assign the codes I21 codes anymore. Instead, you have to use the aftercare codes that is listed under Z codes category. So if the MI is completely healed and no care is needed, what you have to code? You have to code I25.2 because it is treated as an old myocardial infarction because it is completely healed, right? So after completely healing, there is no need of a for coding a live code for the disease. Okay, you have to always code the old myocardial infarction, that is nothing but I-25.2 code. So next, coming to acute myocardial infarction unspecified. So what do you mean by it? So how do you code this one? You have to use code I-21.9. This is used when the doctor says the patient has a heart attack, but he doesn't specify the type or location in the heart. If it's known to be a type 1 STEMI, but the exact site, whether it is the anterior wall, whether it is the inferior wall, is it not documented? So what you have to code? You have to code I-21.3, that is STEMI for unspecified site. So if the documentation is unclear, you have to give code I-21.9. If STEMI but site unknown, you have to assign the code I-21.3. So this is the guideline for the acute myocardial infarction unspecified. And then acute myocardial infarction documented as non-transmural or subendocardial but site provided. So non-transmural or subendocardial means the heart attack affects only part of the heart wall but not the full thickness. That is what it is named as a non-transmural or subendocardial. So if the doctor gives a specific site, you still code it as a subendocardial MI, that is NSTEMI, not STEMI. Okay. So doctor writes non-transmural myocardial infarction of anterior wall, for example. So what you have to code? You have to code it as an NSTEMI, but not the STEMI, because it is a non-transmural. Okay. Next, subsequent acute myocardial infarction. So how do you code subsequent acute myocardial infarction? So category I-22 codes are used for a new heart attack that happens within 4 weeks of the first one. So this can be a new STEMI or an STEMI following a previous type 1 or unspecified AMI. So you have to use I-22 together with I-21. So new MI versus first MI to show the relation between them. So which you have to code first? It depends on the situation and it depends upon the reason for the encounter. Okay. For example, when a patient had a heart attack 2 weeks ago, you have to code I-21 and now he has another one. You have to also code I-22. So I-21 for MI, I-22 for the subsequent myocardial infarction. So this is how do you code the subsequent acute MI. So when you have to not use the category I-22, I-22 is meant for subsequent MI, right? So when not to use this category. So category I-22 is only for type 1 or unspecified MIs. You have to not use I-22 for other types like type 2, type 4 or type 5. So if it's a type 2 MI, you have to use I-21.A1. So if it's a type 4 or type 5 MI, you have to use I-21.A9. For example, if a patient has a new type 2 MI within 4 weeks of the first one, you still use I-21.A1 but not the I-22. There is a difference, okay? So when there are different MI types together within 4 weeks, so different types of MIs might be 1, 2, 3, 4 or types. If there are different MI types together, so within 4 weeks you have experienced different types. So how do you code in this situation? So if a patient has type 1 MI and then type 2 MI within 4 weeks or vice versa, you have to use the appropriate I-21 codes for each type, but not I-22. So category I-22 is only for the recurrent type 1 or unspecified MIs. Let me give you an example. If a patient has a type 1 MI 2 weeks ago and now he develops a type 2 MI. So how do you code? You have to assign both I-21.4 code, that is NSTEMI, and also I-21.A1 code, that is type 2 MI. So use I-22 only if both the first and second MIs are type 1 or unspecified and the second one occurs within the 4 weeks of the first. So this is how you code this types of myocardial infarction. If type 2 MI is caused by another condition like low oxygen or blood loss, you have to code that condition first, then coming to I21.A1 category. So you have to not use I24.89 for demand ischemia, or use instead I21.A1 for the other forms of acute ischemic heart diseases. Okay. So type 2 MI and MI with the coronary microvascular dysfunction. So type 2 MI. So type 2 MI, it happens when the heart doesn't get enough oxygen, right? Not because of a blocked artery, but due to another condition like it may be a low blood pressure, it may be due to severe anemia, due to shock, or due to increased oxygen demand. So this is caused by an imbalance between oxygen supply and demand, not by a clot. So what are the coding rules for type 2 MI? So if a doctor describes it as an NSTEMI or STEMI, still you have to use type 2 MI, that is I21.A1 category code. So the STEMI or NSTEMI distinction does not apply for type 2 MIs. Coming to codes I21.01 to I21.4, you have to use for true type 1 MIs, which are caused by plaque rupture or thrombosis. And next, other specific types. So type 3, type 4A, type 4B, type 4C, and type 5 MIs related to sudden death, PCI, or surgery. You have to assign the code I21.A9, that is other myocardial infarction type. You have to always follow the code first and code also notes. So code first the underlying cause, for example, sepsis, anemia, arrhythmia. Code also I21.A1 for the myocardial infarction. So whenever you see this code first and code also notes, you have to follow them for sure. And myocardial infarction with coronary microvascular dysfunction, nothing but CMD. So what do you mean by coronary microvascular dysfunction? It means the small blood vessels in the heart aren't working properly. They are reducing the blood flow and also increasing the resistance. So this can cause a heart attack even when major arteries are normal or not blocked. So sometimes it may be referred to as a MINOCA. MINOCA means a myocardial infarction with non-obstructive coronary arteries. Okay. So what is the coding for CMD? How do you code it? You have to assign the code I21.B. What is this for? MI with CMD. So microcardial infarction with microvascular disease, right? So whenever this disease is diagnosed, you have to assign the code I21.B. And this is all about the guidelines of the ICD-10 regarding diseases of the circulatory system. And now let's talk about the classification. How the diseases are classified in the ICD-10 alphabetical index and tabular list. Okay. So this chapter, this is chapter 9 ICD-10 This chapter includes all the diseases related to the heart, blood vessels, and lymphatic system. So these conditions affect how the blood and oxygen move around the body. So some of the common examples include rheumatic heart diseases, high blood pressure, heart attacks and coronary artery diseases, heart failure, strokes and other cerebrovascular diseases, and also the venous diseases. So I00 to I09 category codes, they describe about acute rheumatic fever and chronic rheumatic heart diseases. So what do you mean by what does it cover? It covers the heart damage caused by the rheumatic fever. Rheumatic fever is nothing but it is often from untreated streptococcus throat. Okay. And coming to I10 to I16 category codes, they describe about the hypertensive disease is nothing but conditions caused by high blood pressure. For example, hypertensive heart disease. And coming to the code range I20 to I25. So these are ischemic heart diseases. So problems caused by reduced blood flow to the heart. So this includes angina and also the myocardial infarction. So next, I-26 to I-28 category codes, they describe about the pulmonary heart diseases. So what it is, conditions affecting the right side of the heart and also the lungs are classified in these category. You have to code from these. And next, other forms of heart disease. What are the ICD range category? I-30 to I-52. So this includes the heart failure, myocarditis, pericarditis, and also the valve disorders. So cerebrovascular disease. So cerebrovascular disease is a stroke. So this covers stroke, brain hemorrhage, nothing but brain bleeding, and other blood flow problems in the brain. It is completely about the brain related. So next category, I-70 to I-79. These codes cover diseases of the arteries, the blood vessels that carry oxygen-rich blood away from the heart, and also the arterioles and capillaries. So for example, if you take I-70, it describes about the arteriosclerosis, nothing but the hardening or narrowing of the arteries. And then category I-80 to I-89. So what it is, diseases of the veins, lymphatic vessels and lymph nodes. So these codes related to the veins which carry blood back to the heart, and also the lymphatic system which helps to fight infection and remove the waste. So examples like phlebitis and thrombophlebitis are included in this I-80 to I-89 category codes. So coming to the last category codes of this system, I-95 to 99, that is other and unspecified circulatory system disorders. So what does this category include? These codes are for circulatory problems that don't fit into the earlier categories or not clearly specified in the documentation. So examples like hypotension and other and unspecified disorders are included in these categories. So this is about the ICD-10 classification of the circulatory system diseases. So here you have learned about some of the guidelines and also how the ICD-10 CM have been classified. And in the next session, you are going to learn about the ICD-10 CM classification in detail. Like you are going to learn about the codes and codes description and also the subcodes with examples. So that's it. This is for today's session. I hope this video is useful for you. Thank you.